Okay, all right, we're gonna get rolling on put it in the slideshow view. So hopefully that's bigger for you. And we're gonna get rolling on how to then do that DAPO and PA process. So if you kind of walk through it with the pharmacist, there's that whole identifying the patient. Then the very important part is you need to obtain a PA from the DAPO in order to actually bill for that CMR when you've completed that. So we're gonna go through the steps. You know what you're going to do when you do the DAPO calls, you know, the information you need during the call and how to record it. Looking over the ICD-10 codes that they'll be looking for. There's like main ones that the forward goes for, the WPQC ones. Review documentation once the DAPO call is completed. Yep. So DAPO stands for Drug Authorization and Policy Override. They're required to receive that approval for the eligible patients before conducting it. So you want to have that DAPO PA in place before you perform the CMR, because in case when you call and they say, oh, this patient doesn't qualify, you know, or they're not eligible or expired, you know, so some of those things will go through that you can look at before you get to that point of calling too. You have the information already, which we're going to show you all that. There's the Pioneer way. We have a care plan, and then there's also a little sheet that you can get ready. Okay, so first thing, we want to verify that patient is eligible. You can go and check that enrollment on the Forward Health portal. Check that they don't have any current and active prior authorization is very important too. You can go to previous prior authorizations, put in that patient's ID number and do a search, and it'll bring up any PAs they have. And what we're going to be looking for is the 117 physician PA. Those are the ones that are granted for the CMRs. And also when you're checking their eligibility, then you go into like the enrollment button. Check if they have a spend down, if they are senior care. It'll say right in there, the senior care, and it will list right in that patient section if there's a spend down. If there's a spend down left, they'll have some type of copay, and it'll be on the UNC, like it says, depending on it. And we usually want to just hold off on, you know, doing a CMR with that patient, because then they usually don't, you know, that use that spend down towards prescriptions. So you can always like put a memo to check them in a month or two. With Pioneer, with the care plan, you can redo the start and end date of the care plan to bring it up again when you want to check it again. So there's ways you can, you know, mark it to follow up and see if their spend down is complete. Other thing when you're checking for eligibility, if it comes up that they're Medicaid qualified Medicare beneficiary, that means they do not qualify. They have a, you know, a Medicare type thing in replacement. So that particular one, you want to make sure then you pass on them because they're not qualified. Any questions so far? Okay, I'm gonna keep going. Oh, I see something came in there. No questions, okay. The pre-DAPO, so managed care patients are eligible. So they have the MCO, those managed care organizations like My Choice and all that stuff. They are eligible as long as they have the Medicaid senior care eligible also. It'll list it in their enrollment. To have things ready before you call the DAPO is have the following information: is pharmacy NPI and the pharmacist NPI. You'll need both. And then the rep will ask you at the time when they're ready for those. And of course, the patient name, date of birth, member ID, and the reason for the level 2 service. You know, I usually say I am calling in, I have for a PA for a CMR. And they have to have one of the things to meet the criteria. So 4 or more scripts with 2 or more chronic diseases, and have their medications ready that they take for all those diseases. Diabetes, that just one alone is eligible. You don't need to have the other chronic disease, just that diabetes makes them eligible right off the bat. Have a list of their medications, and if it's type 1 or 2. Some reps ask it, some don't. Just always be prepared and have that ready. The other eligibility thing is coordination of care due to multiple providers. You got somebody on 3 different providers, and you're having to juggle basically that their meds are fine and that the questions from all the different providers. So that can help the patients sort out too when you've got different providers and the communication and all that. Discharge from hospital or long-term care facility within 14 days. So very important you get that done within 14 days. And you can carry through for the follow-ups. Basically, you're just following up because there's almost all the time some change of their medications on those. So you're following up, making sure they're staying with their new regimen, or if the doctor put them back to the old regimen, basically following through in that. That's eligibility. And health literacy or provider referral. So the patient is having a hard time understanding their medications, and you wanted some time to sit down and review that more, and just so they have a complete understanding. And then provider referral, we don't see very often, but there'll be times maybe when the physician will just say, I feel the CMR is very necessary or be beneficial to the patient. So the ICD-10 codes, these are the top ones, and it goes with chronic diseases that we will be doing with the WPQC. So we have our hypertension, the asthma, chronic kidney disease, congestive heart failure, dyslipidemia, COPD, depression, GERD, diabetes, health literacy, and then discharge from hospital and coordination due to multiple providers. Any questions at all? Okay. And I want to note that these codes, the ICD codes, will be what we'll be putting in when you do the actual billing, which we'll be having on the next session. We'll be going over that. So you're going to have your dual eligible patients that they're on the Med D and like senior care Medicaid. I'm just going to walk through this here with you just to give you an idea. So we're going to start with our start here. Medicaid members currently receiving CMRA service covered by insurance provider and or Medicare. If yes, they have both. And then if CMR services are billable, we cannot do it through Wisconsin Medicaid. If it's billable through their other insurance, then we'll just be basically not doing it through the WPQC. And one way to determine that is outcomes. I urge all the pharmacists and gets the techs also signed up for outcomes, because then you can always, if you're looking at a list and you have these people that are meeting the criteria and you just want to double check, you can go into outcomes. They're not listed in outcomes. You're pretty safe, because any of the insurances that do have where they do CMRs, they'll be popping up in your outcomes. Just a little side note here for our hometown people, when you're looking at this, if you're a tech and you don't have an outcomes account, reach out to me because I'll get you set up. I'm sure the pharmacist is going to want your help. You can take care of doing tips and stuff and also in outcomes, but then that's also for when you're helping with the CMRs, looking for people, you can determine if you're going to continue on to proceed with a WPQC CMR with that patient. So follow-ups, if it happens that their insurance that's not Medicaid or senior care does provide a CMR, but no follow-ups, which we really don't find, then you can do a follow-up with WPQC. So if you get to that, is if you're new, just reach out to one of us listed on this, because you don't really see that. I was talking to Carrie with that, and we can bring that up to next session with one presenting the billing if she's ever seen that too. So you're going to provide the CMR and bill the members' other insurance. So this is if they have other insurance. Going back to the start here, if they don't have other insurance, then we'll go on down, member has other insurance, no, we'll go to the bottom there. Proceed with providing WPQC or CMR. So you can just keep on going. There's no other insurance, then we're good. Member has other insurance, like we said, but they're not listed in outcomes, then we can continue to go on and do the other with WPQC. Members of their insurance, again, we said too, if they're listed outcomes, we'll take it down. So just look over this slide. If you get questions, let me know. Basically, it comes down to if the other insurance does let you do a CMR, then we can't do it through Medicaid. If it doesn't, go ahead. I know Carrie has stated in the past that she spent many hours trying to, if other insurance would give it, and when they know to this point that if it's not coming up in outcomes, it's not going to be an easy process. And that's what she kind of noted in this dual eligible members box too. Do you guys have any questions at this point on that? No, that kind of was a lot, but okay. Oops, I think I went the wrong way. Sorry. There. Okay, so here's our setups. On the left is for Pioneer for our pre-DAPO information. We have the care plan there on Pioneer. And if you see where it says action, DAPO approved date, this is how we'll get assigned usually to text. This is usually a tech part. And over here, you can see where it says assigned to off to the right. It will let you, the pharmacists do when they're ready to get the DAPO PA done, that they can assign it to, let's say we're going to assign it to Nicole. And then the important part is to put a start date and a due date on so it comes up. And then usually what we just do in the action where it says the DAPO approval date, we'll put the date we called. So it's going to start the PA. And see here, it's got the forward health ID. And then on the note sections, it lists like all the different ICD-10s and disease states. This you can delete out and edit to what just applies to your patient. We can get down to where if it's just diabetes, you just have it with diabetes and put in your drugs there. Spot for pharmacist MPI, pharmacy MPI, and then like your date of the call and the date of approval. Then we'll go over to our standard sheet that we have for that, where you just fill out your patient name, date of birth, your level 2 reason, your disease states, and all that, the MPI and all that stuff, and the DAPO call numbers on there. And for you, put the referral number and all that stuff. So same thing, just the right's on a piece of paper, the left is right within the Pioneer system. Oh, let's see. Okay, everything's going well. To call is the 1-800-947-96227, and you'll do option 3 and option 3. And that gets you to the DAPO rep. Just let them know right off the bat, you're calling today for a prior auth for the CMRI. And let them know too if you have multiple requests. If you happen to be working with 2 different locations, you can only do 1 location per call. But if you have like 6 people you're calling in for PAs, you can do for the same location, you can do it all at the same time. Once you go through, she'll ask you, how they are eligible. They've got 4 more meds and 2 more chronic diseases. And then they'll ask the medication. And then the start date. Usually we want to have, ideally, the DAPO PA in place before. There is a 2-week grace period, but always I stress to get that DAPO in before the CMR, so you don't have to worry about any backlogging or amending. They'll usually inform you when you can expect to see the PA entered into the system. Sometimes they won't, but so just always just ask so because every one of them is different. One might say, hey, I'll have it with you within 10 minutes or 2 hours or give me a day. So just so you know, when you can go back and then look, then you'll, not always be checking that. You kind of have a time frame of when to expect that. And then always ask for the referral call number. If it's not provided, most of them ask you if you want the referral number, but always be sure to ask for that. it's good to have that to reference back if you have any questions regarding to that patient's prior auth or the call, so that way they can easily look it up. So, oops, I keep going backwards on you guys. I'm sorry. Oh, call. So call. Document the call reference number. You know, prior authorization number. You can look it up after you've done that. To find the actual prior authorization number after the DAPO timeframe was given to you. So log into the forward portal. There's prior authorizations. Enter the member ID in the box, click search, and then it'll display prior authorizations for that member. And then you, like I said, we want to look for that 117 physician service prior authorization. Also, if it's just recent too, like sometimes, oh, I didn't get back to my PA and it's been a week or so. But if they said it's in the next day, you go in the next day. Once you log into your portal, just scroll down on your end of providers and it'll list new PAs right there, and you'll see that patient listed, and you can just click on that and it'll open up, display your PA information right there too. And the other important part is that first initial CMR must be completed within 60 days from the start of the prior authorization date. That's, you know, the rest can be anytime throughout the year, those 3 follow-up, but that first initial one must be within 60 days of that PA date. So it's always important to, if you're the tech and you get that PA, communicate it with the pharmacist. Hey, this is ready to go, you know, give the patient a call. In Pioneer, we can complete out that care plan and then assign it to the pharmacist to say, hey, time to call the patient, set up a CMR. Some patients will not be eligible for a full year, and the DAPO rep will look that up. They'll say, oh, it's going to, like, let's say we called in today. This patient's only eligible up until September 30th, unless they renew. Most of the time they renew, but just make a notation on that patient's, either the little note that you have for eligibility to pass on down to the pharmacist, or the care plan like we do in Pioneer. Just always document that so you have that. And here's our, then going back to documenting what we just went through with the DAPO PA person. And you're going to fill in then the date that you called and all that stuff. You won't have the PA number right away. You can always go back and do that with the Pioneer thing here. But once, as long as you put, hey, I called today, and the PA starting this date though. Here's an example of where we called in, but the CMR was done and we had to backdate it. So that's how that would be. We would tell the DAPO rep we needed to start on 5/14, even though today's 5/21. On the right, I have a filled out form that we were just looking at. This patient had diabetes. We list it. This exact form doesn't have that, but you just jot it in there. And it's got all your information down there for you to fill in. So you can have that handy. Making sure nobody has questions. If you got questions, just put them in the chat. I'll check. So at this point, that's pretty much the whole process for obtaining the DAPO PA. Do you guys have any questions in any of that process? Okay. And of course, as you guys get going along and you have anything that comes up, you know, just reach out to one of us. Our emails are always there. And after you do it a couple times, it'll be pretty second nature. It's just that first initial one, making sure you got all the stuff, and you'll get the jive of each DAPO rep. After a while, you've talked to, you know, the same one several times, and you'll know their layout, how they ask stuff. So it's kind of good because you get into a good rapport with them in that. So for next week, we're going to have you guys find an eligible patient. Nicole, you probably said you've been working with, you've probably done some of that. So continue finding them and do a DAPO prep work of filling it out, that form, and may do a couple And if you're, like I said, feeling ambitious, go ahead and call the DAPO and get that PA. And then you can actually have the pharmacist probably then complete the CMR. So it'll be nice if our next one we have, some people that they actually did the PA and complete the CMR and they had success. It's always that great feeling of accomplishment. Guys, any questions at all? Anything you want me to go back and cover over? Okay, sounds good. And here's your code for those that are doing the CE to get your qualification to meet your renewal requirements. Otherwise, I believe that's it for now. I'm going to stop the recording.